we get vaccinated against COVID-19? With the vaccination against COVID-19 finally well under its way, the biggest concern was convincing people to get vaccinated. In the Philippines, for example, during its first rollout with Sinovac vaccine from China, many health workers refused to get the vaccine. First, because they are afraid of the side effects. Second, they don't trust this vaccine because of its 40% efficacy and Filipinos' lack of trust in the Chinese government. And third was the dilemma created by the 2016 Dengvaxia vaccine manufactured by the French company Sanofi Pasteur. It was banned after its makers said it could worsen the disease in people who had no prior infection to dengue. But it's all too late because around 800,000 public elementary students were already vaccinated. There are reports that some children vaccinated died of internal bleeding in the heart, lungs, and brain, which are symptoms of hemorrhagic dengue. Some also are skeptical about the vaccine because they think it was rushed and cannot be trusted. But with all that has been said, in my opinion, we should weigh between the good and the bad. We have to consider that we are at a global pandemic that had never happened in modern times and somewhat put the world at a standstill, and a lot of people were already dying. We have to think not just about us, but also the people around us who are more vulnerable to the virus. If we are immune, we are less likely to transmit it, and we could then stop the exponential growth of the virus, with of course, following still the different safety protocols like washing our hands, wearing a mask, and keeping a distance. It may be not 100% effective, but if we look at the flu vaccine, it's only 40 to 60% effective, according to the Center for Disease Control Prevention, or CDC in America. But it does save thousands of lives yearly. The same with COVID-19 vaccine. It's not 100% effective, but its benefit outweighs the risk. Scientists around the world and different organizations are working round the clock to try and find answers. So these vaccines they develop has gone through all the necessary steps successfully and proven that it's safe. Side effects are minimal, just like any other vaccine, but the effect when you're infected with COVID-19 is far worse. So should we get vaccinated against COVID-19? My answer is yes, we should, so that further transmission could be prevented until such time that the last of the virus has been eradicated. Then we can all go back to our normal lives.